New Brunswick in 2012 had the lowest rate of adoption of technology in physician offices in the country. And we need to move forward, and we're making steady progress in that regard. We've added about 230 doctors to our program over the last couple of years, and we're steadily increasing that each year. But the main goal is to promote connectivity between physicians. And doctors are seeking this out, but the challenge is that they don't have the time or the technological expertise to solicit and find the right program for them, which is why they look to their professional medical association, us, to go out, seek out vendors, and select the best vendor for their needs. The company is called IntraHealth, and their product is called Profile. And they're delivering that product in places like New Zealand, British Columbia, and Ontario. And their service is a web-based, cloud-based technology so that we can easily manage and move data to physicians and connect that data from the physician to the hospital within the healthcare system. And what that does is it makes their offices more efficient and more accessible to patients. And in the future, we're working on things like patient-driven information. So if a patient were monitoring their blood pressure at home, that data could be uploaded to the EMR so that the doctor can track the patient at home. New Brunswick was one of the last provinces to actually put their toes in the pool as far as electronic medical records are concerned. If you're comfortable with a type of technology, whether it's or a style of practice in our case, then the motivation to go from where you're comfortable to something that's new and perhaps unfamiliar is a decision you have to make. What Velante does is try to make that decision really easy. So we take care of the complicated things like selecting the product, managing the training for you and your employees if you're a physician, and then onboarding you onto the technology and providing the right supports so you can quickly adapt to the new technology and leverage the opportunities that exist. We know we have a very sick population in New Brunswick, more so than other provinces. And if we can do things to be ahead of the curve and think forward about what the challenges are for some of those patients and what modifications doctors can make to their practice, I think that's a win for our healthcare system.